Thank you for joining us. Greg Leap is our special guest from the Surgery Center right here in Enid, Oklahoma. Greg, welcome. And before we came on the air, we were talking a little bit about family and so forth, and a couple kids at the university and so forth. Why don't you just introduce yourself, a little bit about your background, if you will, to our viewing audience.
Okay. Well, I grew up here in Enid.
So everybody knows you then.
Well, a few people,
Okay.
definitely. Went to Enid High School, graduated back in 1985, and then went on down to Dallas, Southern Methodist University for school, and was down in Dallas for about 6 years. Migrated back to Enid while I was working on my MBA at University of Oklahoma. At the same time, I was supporting my father's clinical laboratory practice at that time. So at the same time working on the MBA and running a clinical laboratory practice kind of got me back to Enid around 1994, and I met my lovely bride, Lori, here in town, and we've got a couple kids, Aaron and Ryan, who are down at the University of Oklahoma. After the clinical laboratory period, I went to work for Advanced Food Company for over 15 years, and tremendous experience with the growth and success with Advanced Food Company. It was a great experience. And then for the last 5 years, I've been the administrator for Surgery Center of Enid. It'll be 5 years in June, and a great group. Yeah, really enjoyed it.
Very good. Well, that's a great segue, so we can learn now about Surgery Center of Enid.
Yeah, kicking us off, where is the Surgery Center located here in Enid?
We are at 1133 West Willow Road, just directly east of Autry Technology Center. So very easy to find on Willow.
Okay, just east of Autry Tech. And the reason that we asked that is, Greg, there's the local audience that's watching the show, but we have learned that there's life after the show. Once it gets on YouTube, people from around the globe start watching this, and they may not be that familiar with Enid, so that really helps people out. So, okay, on the business card, I think it says administrator.
Yes.
That's a big title. So what is the administrator, or what is your role at the Surgery Center of Enid?
Well, really, it's just to support the organization, honestly. We've got a great team of doctors at the Surgery Center, and nurses, anesthesiologists, and techs. A wonderful group of people. So my job is to support everyone there to make sure that everybody has what they need and everything's working correctly.
Great. For anyone who doesn't know much about the Surgery Center, can you just give us a quick overview of what the Surgery Center actually is?
It is an outpatient surgery facility. We have been operating for almost 25 years next year, and we perform outpatient surgical procedures that really often involve someone checking in early in the morning, like we talked about this morning, getting ready for surgery, having a procedure that supports recovery and discharge really the same day. We have a couple overnight rooms, but we have 4 ORs and 2 endoscopy procedure rooms that support colonoscopies and EGDs. But then we have 2 overnight rooms as well. And there are some procedures that we keep overnight, but all patient visits must be discharged before 24 hours. And again, it's outpatient surgery. Some people, a lot of people have had procedures at the Surgery Center. We perform about 5,000 procedures a year. But there are some people I come across that think that we're more of a minor emergency clinic or something like that. And so, yeah, we're always educating people about what our role is.
Well, you've done a great job explaining what really takes place at the center. My next question is along those lines. You know, what is the goal of the Surgery Center? Yes, it's for the outpatient, but could you really define another goal of the whole organization?
Well,
is it just to be convenient?
It is convenience. It's obviously excellent patient care with convenience at the same time. We have fantastic hospitals here in town that perform outpatient procedures and inpatient support as well. But a surgery center is all about convenience, accessibility to support those same outpatient procedures at often a much lower cost.
Before Aaron asks you another question, I just had this thought that it seems like there's a real challenge in the state of Oklahoma in rural areas to get the health care, because people have to leave XYZ town and drive all the way to Lawton, drive all the way to Oklahoma City, Tulsa, whatever it is. So with the Surgery Center of Enid located here, do you know if it's helped people to really get access to health care? Because they may not be able to drive to the Lawtons and the Oklahoma Cities.
Sure, sure. Oh, I really believe so. In fact, I see many people come in from all over Northwest Oklahoma to have outpatient procedures done, out into the Panhandle, north of I-40, even from southern Kansas, to have these procedures performed. So we see it all the time. And with Surgery Center of Enid and some of the programs that we're in, we're even bringing some people out of Oklahoma City and Tulsa for some procedures with some innovative health plans that allow these people to have procedures at no out-of-pocket costs.
Wow. That's amazing.
It really is.
Are there any, you kind of touched on this a little bit with convenience. Are there any other advantages to going to the surgery center versus going to a regular hospital?
Another advantage is often less infection rates. On an average across the country, nationwide average, surgery centers have lower infection rates.
And that's because?
That's because, you know, you have to be well and in good shape for outpatient procedures. And, and so we see, I mean, if someone has infection concerns, those are often procedures that we cannot support at a surgery center, and people that are ill often need to go to a hospital. So the referring surgeon and anesthesiologist and our CRNAs evaluate the patients to make sure that they are well and to support good expected outcomes.
Good morning, Nina. Thank you for joining us on this Thursday, February 21st. It's 7:47, and Greg Leap is our special guest today. If you go, Greg, to the website, you will see a list of doctors and services. Can you kind of give us a snapshot of what are some of the services that are being offered at Surgery Center?
Absolutely. We are a multi-specialty surgery center, and so we do all kinds of procedures. Again, we've got 4 ORs and 2 endoscopy procedure rooms. So in the operating rooms, procedures like orthopedic procedures, knee procedures, shoulder procedures, we do podiatry, we do eye procedures, do a lot of cataracts, urology procedures, a lot of pain procedures, pain management procedures, really the full gamut of outpatient procedures in the ORs. And then also in the endoscopy rooms, we do a lot of colonoscopies and EGDs, a lot of screening colonoscopies. Again, next month is colon cancer screening month, and so boy, these colonoscopies are a great tool to really stay ahead of colon cancer concerns.
You have all these amazing services. Can anyone use it, or are there only a specific type of people that can use it, or who can actually use this service?
Good question. Who can utilize this?
Really, everybody can use it, and we support all ages from extremely young to aged patients as well. Again, you have to be well, and that's the case for any outpatient procedure, whether you're in the hospital or at an ambulatory surgery center, but anyone can use these. And we support patients that have a health insurance plan under managed care, many Medicare procedures, and then even private pay, self-pay individuals as well.
Let's continue with the theme of individuals. If an individual doesn't have a primary care physician, they don't have a doctor, they're just new, can they come to the Surgery Center of Enid to just kind of get some guidance? Maybe they left a state for a new job opportunity and they were supposed to have surgery 6 months ago, but they put it off because they moved, and here they come to Enid. Can they come to the Surgery Center of Enid and say, okay, what do you offer? And
absolutely.
Can they do that to get some guidance, I guess is my question.
Absolutely. We certainly can discuss those procedures with those patients and then help connect them to a physician on staff. We have almost 30 physicians on staff, and so we can absolutely help connect them to a physician that can support that procedure.